Marissa is a senior in high school and has just been brought in for her first therapy session because her mother wanted her to come talk to someone because of her concerns about Marissa's aggressiveness and distant personality. She has had several incidents in school and her mother was very worried for her mental well-being. Let's meet Dr. B, Marissa, and her mother, Tammy.
Hi, I'm your therapist, Dr. B. It's nice to meet you, Tammy.
It's nice to meet you also.
It's nice to meet you, Marissa.
Marissa, say hi, honey.
No, Mom, I don't want to be here. I don't even have problems.
Marissa, I didn't say you had problems. I just want you to be polite.
I don't care.
Marissa obviously doesn't care or have much regard for others. This explains her outrageous actions towards others at school. Keep watching to find out what her final diagnosis will be.
Marissa, your mother is right. No one said you had problems. We are here simply to just talk. Now, how about you two come and have a seat in my office? Okay, ladies, how about we start with Tammy? What kind of behaviors have you been noticing from Marissa that are concerning to you?
Well, Marissa, as a young child, was happy until she was about age 5. And then she began to be more distant, and she started not really having a conscience. And now as she started in her teenage years, she seems to be in her room all the time. She is fascinated with fire. She loves to light fires in the backyard, which is alarming to me because I feel like she can hurt herself or she could burn down her house.
Yeah.
So it's really scary, and she tends to rage at me and her father a lot. She's had some serious incidents at school where she's hurting some of her classmates. And I'm afraid that if we don't stop this behavior now, it's going to become a lot more serious.
Yeah.
Mom, stop. It's because I don't like people, okay? I hate everyone in that school, and I just don't want to be there. You don't understand.
Okay, thank you, Tammy, for helping me out with that information, but I think it would be best if I spoke with just Marissa alone now about some of the things she's dealing with.
Okay.
Yeah, that'll be great.
Thank you, Dr. B.
No problem.
This is the incident that occurred with Marissa and her classmate Sarah yesterday. Keep watching to see her actions. Hey Marissa, do you want to be my partner for the literature project? I don't have a partner yet and neither do you, so it'd be fun.
It's gonna be a no today and a no forever. Just leave me alone.
Marissa, please. I promise not to bother you, and we could work well together. You literally live right down the street from me. I could totally walk to your house so we could finish it.
Did you not hear me? I'm working alone, and you're not coming to my house. Just leave me alone.
I just wanted a partner, please.
Find someone else and go away.
Why are you getting so mad?
And take your stupid pencil.
Okay, Marissa, would you like to talk about what happened at school yesterday?
I don't know what you're talking about. I did nothing wrong. I just simply put someone in their place.
Now, what exactly did you do to put Sarah in her place?
I punched her in the face, then stabbed her with a pencil on her hand.
How did you feel after you did that? Did it make you feel better or worse?
I didn't feel bad at all. Actually, I felt nothing.
What did Sarah do to make you want to hurt her in that way?
She would not stop bothering me to be her stupid partner for the dumb project after I already told her I wanted to work alone. She's so stupid and obnoxious. It's not my fault she can't take no for an answer. She just needs to get a grip and leave people alone who obviously don't like people.
Marissa, how about we think of some ways to handle our anger in a better way instead of hurting others?
How about we not? You just write on your little clipboard that I'm good to go so I can leave and we never have to see each other ever again. And you know what? You're lucky I just didn't kill her.
You know, I can't do that. And don't you want to stop feeling so angry all the time and hurting your friends? And have you ever had any other thoughts of killing people?
Here's a fun fact for you. 1, I don't have any friends. 2, I could care less about what happens to the people I hurt. They deserve it anyway. And yes, I want to kill people all the time because they piss me off. And 3, leave me alone.
Okay, how about we take a quick 5-minute breather so we can calm down? Sound good?
Anything to get away from you.
Hi, Tammy, can I speak with you alone in my office for a second?
Sure.
Thank you. Okay, so obviously Marissa has some serious mental issues. Are there any events in her life or childhood that you think could have attributed to this change? Like a fall or something where she could have hit her head, or maybe even a traumatic event?
I do recall when she was about 3 years old that her father dropped her by accident and she hit her head. And she had this huge goose egg for like 2 or 3 days. But I don't recall if that was anything serious.
Okay.
Marissa, when she fell, she most likely hit her prefrontal cortex, which would have caused her to have inability to make morally and socially acceptable decisions and never fully develop social reasoning, which causes aggression followed by no empathy for others, which is a lot of the symptoms that Marissa exhibits.
Oh yes, that fall sounds pretty rough. I would definitely suspect some brain damage, which could have caused a lot of the problems that Marissa struggles with. After first talking with her, hearing her symptoms, and hearing about this fall, I would diagnose her with antisocial personality disorder.
Oh my goodness. What does this mean? Can she be cured?
Well, unfortunately, this diagnosis isn't exactly curable, and treatment options are very limited. It's going to take a lot of time and therapy sessions to get her symptoms recovered, especially if there's significant brain damage.
Well, how long do you think?
In most patients, it takes at least 2 years.
Oh my. This is a lot to take right now.
Yeah, I understand. However, I promise I will try my absolute best to heal her. Luckily, this clinic is very experienced with healing cases like these, so you're in very good hands. I will let you have a minute to yourself out in the waiting room, and I want to get Marissa back in here to finish this session.
Okay, thank you, Dr. B.
Oh, and don't tell Marissa that she's definitely diagnosed with any problems. We don't want to make her feel overwhelmed, like she has problems. I will just treat her like any other patient, but still implementing the treatment processes.
Okay.
Dr. B talks with Marissa and tries to do exercises in order to treat her condition. Marissa fights it off but slowly improves.
Hi, Marissa. Good to see you today. Let's go back to my office. Okay, Marissa. Let's start today with playing some games.
How about we take a nap?
No, Marissa. I'm sorry, but I'm here to help you. We need to take this serious so you can start feeling better.
Ugh, whatever. What even is this game?
Okay, we're gonna both go back and forth and say nice things about each other. For example, I will say, Marissa, your outfit is very cute today. Then you would say something nice to me. See how that works? Okay, good. So now you try.
Dr. B, I think your hair looks dead and you need a trim.
Okay, now Marissa, you know that's not what I meant. I need you to take this seriously or you will never be treated. And then you will have to keep coming back in to see me for more sessions. And we both don't want that.
Ugh, you're right. I definitely don't want to come back and see you, so I'll take this serious. I like your smile. There, does that count?
Yes, that's perfect. And thank you. So now, I will say something nice about you. Marissa, you have really pretty eyes.
Thanks.
Okay, so the object of this game was to get you to think and express positive thoughts in order to get those negative thoughts out of your head, like hurting people or doing negative actions. You did a great job once you took it seriously. Now let me ask you, how did it make you feel to get and receive compliments?
It actually felt kind of good.
Good. Now, whenever you think negative thoughts about other people or yourself, just think about this activity we did and remember to think of positive thoughts because it makes you feel much better.
Okay, I will try, but no promises. People are just so annoying and obnoxious sometimes. I can't help but want to hurt them.
I know, and we will work on that. But just start by remembering this activity, okay?
Okay.
Okay, great session today, Marissa. I hope you have a great rest of the week, and make sure to keep your positive thoughts in and your negative thoughts out.
2 years later. Dr. B is meeting with Marissa for the first time in weeks. Her condition has seemed to improve, so she has been going to therapy less. Let's check in and see how she's doing
Good
now.
morning, Marissa. It's nice to see you again. How are you feeling?
You too, Dr. B, and I'm feeling pretty good.
No, really. How have you been feeling? Any negative thoughts or thoughts of inflicting pain on others recently?
No, not in the past couple of weeks. I've been keeping positive thoughts and tried to stop thinking about killing people and hurting them, and to just focus on me.
That's awesome. You've come so far. I'm very proud of you.
Thankfully, Marissa's antisocial personality disorder diagnosis was caught early. Although this diagnosis is considered a lifelong disorder, some symptoms, particularly destructive and criminal behavior, may decrease over time.
Thank you. I've been working really hard and doing all the exercises you taught me.
Okay, well, Marissa, it looks like this is going to be our last session for a while since you have significantly improved. However, if you start to have some of those serious symptoms again, you can always come back in to see me.
Okay, thank you, Dr. B, for everything.
One factor that contributed to Marissa's diagnosis of antisocial personality disorder was the genetic aspect called temperament. Her mother, Tammy, too, struggled with this disorder when she was younger and was able to overcome most of the symptoms by adulthood. Tammy never informed Dr. B or Marissa of her diagnosis throughout Marissa's time in therapy.